talking secondary claims and the ones that you may be able to claim based off what you're rated for. For a complete list of some of the more common and unknown at times secondary conditions, check out the link in my bio for this secondary claims ebook. You will see that we just put up. It has a great intro message along with a variety of conditions there, some of which I will be discussing and covering now. So the first one we're going to hit on here is going to be for bruxism, teeth grinding. This is something a lot of veterans do deal with specifically, and it gets rated a few different ways, right? Depending if we have a limitation of opening the mouth or if we have teeth loss. So we're looking at 9905 for the range for TMD, or we're looking at 9913 if we're looking at teeth loss and so forth. So this is a secondary that can be claimed to PTSD, anxiety, for example. So you have to have a diagnosis and you have to have the primary. Bruxism by itself won't go. You're pretty much saying it's having secondary to PTSD, that whole sleeping and TMJ situation there, right? So you have to have a diagnosis and have to be able to argue, to help you argue that. So that's the first one. Jumping over to the second one, diabetes, secondary to sleep apnea, for example, PTSD or depression, right? As you see here, the rating criteria can go from 10, 20, 40, 60, or 100, depending on the level of your diabetes and the breakdown you see there as far as CFR is concerned. So again, you have to have a diagnosis and again, a nexus letter to help make the argument as to how you're connecting then the diabetes to the primary condition, which in this case we're highlighting as PTSD, sleep apnea, or depression. Jumping over to the next one, we have SMCK. So now here, people usually think ED, erectile dysfunction, but this can also be female sexual arousal disorder. And as you see in the highlighted, it could be for a variety of different things. So this looks at loss of use of a hand, foot, buttock, for example, creative organs, blindness, one eye, and so forth, hearing, deafness, and whatnot. It breaks down that information there. The biggest thing here, it's a special monthly compensation, so it gets rated a little bit differently, where here you will see it plays 128.62 on top of whatever your rating is. So if we're looking at erectile dysfunction or female sexual arousal disorder, that is something that can be claimed secondary to PTSD, depression, anxiety, for example, to name a few. Jumping over to fibromyalgia, secondary to PTSD, anxiety, depression, sleep apnea. This is a big one here for many veterans. Again, you have to go get seen, rheumatologists, specialists, and so forth to be able to rule out other autoimmune issues and get down to fibromyalgia. Now, once you're there and have the diagnosis, 10, 20, 40, depending on where you're at symptom-wise, as you can see there behind me. So fibromyalgia, secondary to depression, sleep apnea, PTSD, anxiety is one. Jumping over to the next one, we have hypertensive